Nicole Rajan Brown. I'm a proud midwife and I'm proud to be supporting the Maternity and Midwifery Forum, who have helped me to grow, and for creating wonderful professional digital and online resources for midwives across the globe. The Maternity and Midwifery Forum ran their programmes free and online all through COVID. Now we want to grow the catalogue, spread it worldwide and keep it free to use for students and staff. To do this, we have launched a fundraising appeal to help keep all of the 8 wonderful maternity and midwifery festivals free. Keep the weekly Maternity and Midwifery Hour and the weekly newsletters free to midwives and maternity staff. You regularly tell us how much you value these free resources, so do give what you can.
Welcome to Matflix, video streaming from maternity experts. My name is Dr. Jenny Hall. I am the box sets curator at Matflix, a fellow of the Royal College of Midwives and a former editor of The Practicing Midwife. At Matflix, we bring together videos of talks from top maternity experts into box sets to support your continued professional development, study and revalidation. It is a perfect study accompaniment for midwives, maternity professionals, midwifery students and anyone thinking about a career in the maternity services. My job is bringing together the latest thinking area by area so you do not have to. Not only do you get the video of brilliant talks and relevant content in thematic box sets, you also get access to the audio version so you can listen on the commute or while you walk the dog. Plus links to the latest research in the relevant field, government policy documents, the presenter's PowerPoint and more besides. Sign up to Matflix now for the best video streaming from maternity experts.
It's always a pleasure to be here, and I always try as hard as I can to support this excellent platform that's so flexible, that's responsive, that's contemporary, that's in people's homes, in people's pockets and in people's hands, wherever they happen to be.
I'm Nicole Rajan Brown. I'm a proud midwife, and I'm proud to be supporting the Maternity and Midwifery Forum, who have helped me to grow, and for creating wonderful professional digital and online resources for midwives across the globe. The Maternity and Midwifery Forum ran their programmes free and online all through COVID. Now we want to grow the catalogue, spread it worldwide, and keep it free to use for students and staff. To do this, we have launched a fundraising appeal to help keep all of the 8 wonderful maternity and midwifery festivals free. Keep the weekly Maternity and Midwifery Hour and the weekly newsletters free to midwives and maternity staff. You regularly tell us how much you value these free resources, so do give what you can.
Welcome to Matflix, video streaming from maternity experts. My name is Dr. Jenny Hall. I am the box sets curator at Matflix, a fellow of the Royal College of Midwives and a former editor of The Practicing Midwife. At Matflix, we bring together videos of talks from top maternity experts into box sets to support your continued professional development, study and revalidation. It is a perfect study accompaniment for midwives, maternity professionals, midwifery students and anyone thinking about a career in the maternity services. My job is bringing together the latest thinking area by area so you do not have to. Not only do you get the video of brilliant talks and relevant content in thematic box sets, you also get access to the audio version so you can listen on the commute or while you walk the dog. Plus links to the latest research in the relevant field, government policy documents, the presenter's PowerPoint and more besides. Sign up to Matflix now for the best video streaming from maternity experts.
always a pleasure to be here, and I always try as hard as I can to support this excellent platform that's so flexible, that's responsive, that's contemporary, that's in people's homes, in people's pockets and in people's hands, wherever they happen to be.
I'm Nicole Rajan Brown. I'm a proud midwife, and I'm proud to be supporting the Maternity and Midwifery Forum, who have helped me to grow, and for creating wonderful professional digital and online resources for midwives across the globe. The Maternity and Midwifery Forum ran their programs free and online all through COVID. Now we want to grow the catalogue, spread it worldwide, and keep it free to use for students and staff. To do this, we have launched a fundraising appeal to help keep all of the 8 wonderful maternity and midwifery festivals free. Keep the weekly Maternity and Midwifery Hour and the weekly newsletters free to midwives and maternity staff. You regularly tell us how much you value these free resources, so do give what you can.
Welcome to Matflix, video streaming from maternity experts. My name
Good evening, everybody, and welcome to this week's Maternity and Midwifery Hour. My name's Sue MacDonald, and I'm the curator for the Maternity and Midwifery Hour and the Maternity and Midwifery Festivals, and it's my pleasure to be chairing this evening's hour. And we're joined this evening by Dr. Sally Pizarro and Gila Zabiv. And because we always do this, and I know our audience really enjoy this bit of just getting to know a little snippet about our speakers. We always ask for a moment of the week. So I'll ask Sally first, if you'd like to share your best moment. Oh, no, maybe not the best moment, but a moment of the week with us.
Okay, well, my best moment of the week was that, we've had our book published, and it arrived in the post this week to me so that I could actually hold my own book written with Dr. Karen Marr, Surviving and Thriving in Midwifery. So that's exciting for me, and hopefully everyone else who received it.
Wow. And also, we really need that at this time in midwifery.
Hope so.
Fabulous. Looking forward to reading that one. So thank you, Sally, and congratulations on the safe arrival. And I hope you don't have any postnatal depression with it.
I hope not either.
I'm sure you won't. And how about Gila? Welcome this evening. Do you have a moment of the week you can share with us?
Thank you so much for having us. I think my moment of the week was celebrating my mother-in-law's 70th birthday, which was really, really special. It was a really unique experience, spending time with family and celebrating her, and it was really wonderful.
Oh, that's lovely.
That's not as special as Sally's, but
well, they're all special because these are professional moments and they're personal moments, but they all warm your heart, don't they, and stay in your memory as something very special. So thank you so much for sharing your moments. Now we're going to let our presenters have a little rest while I just remind everybody where we've come from. And this is especially in my mind at the moment because this year is the 5th year since the beginning of the Maternity and Midwifery Hour. Before that, we had the Maternity and Midwifery Festivals and the conferences, study days and events. But obviously with the COVID-19 lockdown, the first one in the UK, midwives, student midwives, doulas, all the women and well, all the contributors to maternity services actually couldn't meet in the same way. And we thought it would be good to start just an hour a week, that people could link in, talk, find out some information about, especially at that point, a lot of it was about COVID, but it was always focused on midwifery and maternity services, on mothers and babies and midwives and student midwives. And I always remember those days because apart from being very scary, because we didn't know very much about COVID, we didn't know what the effect was going to be. Apart from that, it was a very exciting time from the service point of view because people were doing some fantastic things with the services to make sure women and babies and families had safe care. And also students were able to get their learning as well at the same time in a safe way. So it meant a lot of juggling, and Sally will probably remember this as being in education. You had to juggle curriculums and courses around to make sure it all fitted. And people started using things like Zoom and Teams a lot more and got a lot better at it. And we've carried on. So we don't really talk so much about COVID except in this first bit because it's always overwhelms me to think there's 5 years now and we're still going. And it's been especially poignant because there's been a lot of reports recently. There was a TV documentary last week that was talking about people's experience, and it was very difficult. And yet there were some lovely moments as well, but the things that we shouldn't forget. And one of them is being able to connect with each other. Now, the other thing I have to say is everything here is recorded on the Maternity and Midwifery Forum. Everything is recorded. If you go to conferences or festivals, you go to spotlight events, all this hour, everything is recorded. So if you miss anything, or you want to replay it, or you want to place it at your place of work or at university or college, you can access it through the Matflix. Now, that's my point to say. You will have access to all of these different resources on your resources sheet. So there is a link to Matflix, so you can go and have a look there. This is a very useful place. Useful for those of you who might be looking to do your revalidation. Useful for people like students or midwives who are doing courses. Anyone who's doing any study is a fantastic resource where you can get information, research and practice developments in a very accessible format, and you get all the conference lectures and everything there you can get. The health warning to this is once you go in there and you start looking, and you might look at one thing, maybe you won't do this, but I often do this. I go in to look at one thing and then it takes me somewhere else. I think, God, that's interesting. I'm going to just go there. 3 hours later, the time's gone, but my brain is a little full. So that's the health warning, but it's a good full. So you do share. So this evening, I think that you'll find it really interesting. And so do feel that you can share with colleagues. And you will have a link to this. Certainly it'll come on Friday on the podcast and also on the Tuesday newsletter. And you can share it with colleagues. We like you to share, and it's also a very good way of getting a debate going and getting us thinking in a different way. So do that. And I'm also going to say a big thank you to our midwives and students who are there at the workplace working today and yesterday and tomorrow so hard to look after women and birthing people and babies and families, everyone in the maternity services. For all that you're doing. And I know it's hard, especially today when people are talking about the NHS having its lowest satisfaction score. Still 59% of people are happy with the service. And it's a bit painful if you're trying your best to give a good standard of care. This is why I think we need Sally's book, definitely, to just sort of support us a little bit. And the other thing is, I put on the link to a link to birthrights, because I just heard on one of the, and I think it was Twitter, it could have been Blue Sky, about an investigation by Birthrights finding that 2/3 of trusts in 2023 to 2024 were not encouraging women to have home births. That's quite a big thing. And I thought that was very interesting. So I put a little link on that so you can have a look at the original report and have a look at a birthright, because that's a really good source of evidence-based information and with a legal tenet to it. And I've put in a link to the Human Rights Act bit of it. It's a very good link. Also, today I have to say Eid Mubarak to those of you who are celebrating, wishing joy and happiness. And I think above all, actually to everybody, some peace and stability in this world, because we were talking before and it all feels a bit crazy. And we just have to, I think, go from day to day, do what we can, do our best to care for the people around us. That's all we can do. And this almost gets me perfect timing. I'm going to pat myself on the back and feel very good about this. This week, we're going to look at midwives' identity, and we're looking at a really groundbreaking, I have to say. I think it would be a groundbreaking research study into midwives and nurse midwives and their professional identity and how this affects their representation in the public sphere or public realm. And I think this will be fascinating. I always say to this, I love to hear research from the researchers, because they know all the little things that went on and make it really come alive. And I'm so delighted I've got two of them here. Fantastic. I'm going to start by introducing our wonderful Dr. Sally Pizarro, remembering also this is edited highlights, because both of our speakers' CVs are online as well, a little bit fuller. And Sally, she's an old friend. She's been on the hour several times because she's so fantastic. She's Programme Director of a Structured PhD at Coventry University. I believe she's actually looking for students at the moment, maybe. So if you're wanting to do a PhD, she's your woman. She's also a Fellow of the RCM and the Higher Education Academy and an NMSC panelist, can't even say the words. And the audience will know Sally's work into addressing inequalities in reproductive services, improving understanding of the needs of trans and non-binary people, domestic violence and well-being of midwives, which she's just illustrated by a brand new book. And alongside Sally from Canada this evening, big welcome to Gila Zabiv. She's a midwife and a passionate PhD candidate from Ben Gurion University of the Negev, bringing global insight into what it means to be a nurse midwife in today's world. So welcome to Gila and to Sally, and I think Sally's going to start off. The screen is yours, and thank you so much for both coming.
Thanks very much, Sue. Yeah, I'm going to be presenting first, but Gila's actually got control of the slides. So can we get the first slide, please, Gila? Oh, okay. So the reason this work started really was because we were beginning to see things in terms of nurses being represented everywhere and midwives being the poor relation. So it was always nurses and midwives, just midwives, on the sideline. And anytime there was any kind of celebration, like the Florence Nightingale Foundation or Mary Seacole Awards, it was always for nurses and midwives. But Florence Nightingale and Mary Seacole, they weren't midwives necessarily. So we were thinking we didn't really have that historical past to inform who we were and where we were going and have that kind of legacy or anchor to our profession. So I'm not a historian myself, so I reached out to Professor Mary Fussell from Johns Hopkins University in America, and her specialism is in midwives of old kind of times. That's really bad to say, but she's this historical focus on midwives 15th century and around about that time. She'll hate the way I've introduced that, but that was what fascinated me. And when we got together and started talking, she said, yes, obviously there's no kind of real midwife figures like Florence Nightingale and Mary Seacole, they have there for nursing. So we published in the Lancet, Midwives Need a Usable Past to Shape Their Future, where we kind of said and observed really that there was all these historical caricatures of midwives that, they were drunk, they were not to be trusted, whereas nurses had a completely different professional identity. So we wanted to put that in writing really to say, where do we go from here? We need that past and we need that identity. And that quote there is from our study that we're going to introduce today, because the midwives there also thought, we have lost our historic representation. Our voices and relics have been erased. Who are we and who's our Florence Nightingale today? So if Gila goes to the next slide, I'll talk you through how we started doing some actual research rather than just observing and talking about things. So we started with some stakeholder engagement. I'd already linked with Johns Hopkins University, but Japaigo at Johns Hopkins University were also really keen to do some work through the Nursing Now Challenge. If anyone of you knows the Nursing Now Challenge, it's a global organisation that helps nurses and midwives to thrive and flourish and do great things. So via Coventry University, I was actually working with Lisa Bayliss-Pratt, Professor Lisa Bayliss-Pratt, who was leading the Nursing Now Challenge at the time. And I kind of said, Nursing Now Challenge, where's the midwifery representation? It's supposed to be nurses and midwives, but where's the midwife? So we started to build Midwives in Focus, which was a program within the Nursing Now Challenge to look at midwives in focus, who we were, what we were doing. And there were two large studies that came out of that work, which I led. One is the study we're going to show to you today, which is the professional identity work. And the other was a big piece of work on leadership and what are the 10 characteristics of midwifery leadership coming through throughout the world. So we got these people together and we did lots of webinars. Can I get the next slide, please, Gila? We did lots of webinars where we kind of brought people from all over the world, nurses and midwives, together to say, look, what do we need to research? What do we need to explore? If we're looking at professional identity, what would be useful? And they definitely said that this was needed. It needed to be global. It needed to be done online so we could reach as many people and countries as possible. And we designed this study together, mixed method study, that was going to measure midwives and nurse midwives' professional identity, and then explore that in greater detail and think about what people wanted in terms of their representation and where they wanted to be represented, the mediums they wanted to be represented with. So this was published last year. only just last year on 26th of December, and it was you know, stirring up a lot of interest right from publication. So it's really great to be sharing the results with you today in more granular detail. So there was lots of authors involved, lots of them involved with the Midwives in Focus and Nursing Now Challenge. Obviously, Gila was one of the authors, so Gila knows this work as well as I do. Can we get the next slide, please, Gila? So in terms of what we did with this, our aims were, with respect to nurses and nurse midwives, measure and explore the professional identity and explore how midwifery profession may be best represented in the public realm. So we collected mixed methods data using that global online survey from February to July 2022. So the recruitment webinar I was talking about, where, you know, we did some stakeholder analysis, those same people we invited to a recruitment webinar, and we got 64 people from 26 countries to say, look, we're doing this study. Can you please fill out this survey? But not only that, can you share this out to your local and global networks, share it as far as wide as you can. That was our kind of global launch of our webinar. And we got a total of 860 participants. Unfortunately, it wasn't an even spread across the world and different countries, but we did have the top 10 participant countries there. You can see largely Australia, United Kingdom and United States, which wasn't exactly what we wanted, but considering the survey was only done in English and, you know, led by Coventry University, it's not surprising, but I think we could do better in future. But the representation of midwives was relatively equal, not too different, not too wide a split, which was really good for this type of measurement. So I want you to start guessing who you think had the higher professional identity score. Would it be midwives or would it be nurse midwives? Who would have the strongest professional identity scores before I reveal to you? And I want to know in the comments whether you were right or wrong and whether you're shocked by the answer. So if we could have the next slide, please, Gila. Okay, so with quantitative data, we did the non-parametric Mann-Whitney U test to compare the nurse midwives with midwives across different dimensions. So the scale actually comes across 4 dimensions, which we were able to look at with the qualitative data we collected. And we just looked under the qualitative data in terms of professional identity and then representation. So we looked at them differently rather than all together. So we could get a bit of nuance about what they were talking about, nurse midwives and midwives in relation to their professional identity. And then we took them to exploring the professional representation in the public realm. Please may I have the next slide, Gila. So that's just to show you how the study worked out. It was a mixed method study. So we did the qualitative data and the quantitative data together at the same time, and then we analysed them at the same time. But what's really important with mixed method research is that you merge and interpret them together at the end. So we were able to see under each of the quantitative scale segments which part of the qualitative data that was talking to. So that gave us much richer insights into what was going on there. And really kind of made it a good study and approach for this type of research and what we were trying to achieve. Next slide, please, Gila. So our main findings, this is if it shocks you or not, nurse midwives had the higher levels of professional identity than midwives. And when I talk to people, lots of people are shocked by that. And they think that midwives are going to have the stronger professional identity, but this was not the case. We actually showed that there was a diminished public professional identity scores among midwives, which is a finding in itself. Both the recruitment and retention of midwives is related to those lower professional identity scores. So important that we need that professional identity to increase our recruitment and retention. And when it's lower, as the scores were here, it's related to people leaving. There's challenges in relation to some midwives' overly strong professional identity, unfortunately. So this is like an unhealthy professional identity. And these could lead to poor teamwork, resistance to change, incivility and bullying. So where people were like, I'm a midwife, that's what all I do. If you cut me through, you know, you'll see a stick of rock through me. I'm a midwife, I've been a midwife, I'm never going to change. Those kind of attitudes were actually quite unhealthy at times. Rather than being a strong professional identity, it was an unhealthy and overly strong professional identity. And also midwives' professional identity, status and recognition in society were key to improve perinatal outcomes, recruitment and retention. That came out throughout the data that they really needed this strong professional identity, where it was evidenced to be either quite weak or too strong. And there needs to be a balance of both the art and the science of midwifery, moving away from gendered stereotypes. A lot of people wanted the representations to be very science-based. You know, we're evidence-based practitioners. We don't just catch babies, we do research, we do teaching, all of these things. And then other people were saying, you know, we have to have very gendered stereotypes of women being with women and hands holding hands and those kind of things. And it was all about the art of midwifery and nothing about the science. So there was this kind of pull and a need for balance between those two things. And the development of future professional identities in midwifery may usefully be reimagined away from religiosity. So we saw some midwives say that they were doing God's calling, or it was a calling or a spiritual thing in general, which was often unhelpful and unhealthy as well in the sphere of professional identity development. And they also had very rigid ideas and excessive endurance, which wasn't very helpful when the profession is trying to be innovative and reinvent itself, and be progressive and adaptable to opportunities and changing societies. So we suggested that we actually need to frame professional identity more around excellence in what we do and the well-being and outcomes we can achieve in doing what we do. But that was a larger discussion. You'll have to read the full paper for that. Next slide, please, Gila. So these were the themes that came out in terms of the qualitative data. So there was pride and passion in midwifery, but equally pride and passion in nurse midwifery. We saw both saying they love their job, loving what they do, very proud of what they do. That motivational religiosity was there. You know, as I said, it's a calling, I'm doing God's work, etc. And there was a lot of celebrating of role diversity. So people liked it, that they weren't just doing one job all the time. They weren't just catching babies. They were leading in policy, leading in clinical guidelines, education, leadership, regulation, research, those kind of things. And that was a real strength in terms of the professional identity. And there was a clear call, it couldn't have been clearer, could it really, Gilla? A clear call for the separation of nursing and midwifery. People were saying, you know, I'm not a nurse. Why am I being called a nurse when I'm not? Or I had to be a nurse before I was a midwife, but I really only wanted to be a midwife. And this was actually, in some cases, a barrier to people joining the profession because they didn't want to have to become nurses first. So they just said, I won't do it at all. So we were seeing those blocks coming through there, which was really sad. And then in terms of barriers to midwives developing a healthy professional identity, they said, look, nobody recognizes us in society. Nobody knows what we do. Nobody knows who we are. People think all we do is catch babies in labour wards or whatever, and they think we're subservient to doctors, and no one really had a good idea of the identity of a midwife. And equally, the midwives and nurse midwives saw that coming from other professional groups. So doctors weren't respecting them, surgeons weren't respecting them. Even then, sometimes it was you know, pitting nurses against midwives, one being more respected than the other. So they just not being respected, you know, impacted on their own professional identity and stopped them from having a healthy one. And then in terms of the representation of midwifery in the public realm, people suggested a lot of imagery to represent midwifery. And this was really, really vast. We had so many different things coming through, but it was generally things that they wanted real people and real stories. And you know, the Florence Nightingale, who was our midwifery Florence Nightingale, coming through. And in terms of suggested mediums, people suggested you know, statues and that kind of thing. And if Gila moves on, we'll see what they said. So these are just some of the quotes. I won't read each and every one of them on screen. But you can see an example there of an overly strong, unhealthy professional identity where someone said, you know, they'd sacrificed everything, really, not getting married, not having children because they wanted to do this job and nothing else. So it affected them that bad. And living and breathing and sweating midwifery, just having nothing else. And that was kind of unhealthy. You know, when we had some occupational psychologists on our team, and that's what helped us understand that. Can we move to the next slide, please, Gila? And again, this is the same, but for nurse midwifery. So when nurse midwives talked about their passion, they talked about being in project management and having skills that they were respected in and they could gain in. You know, you could really see the difference between the pride and passion that nurse midwives had than midwives had. It was still pride and passion, but the difference was they were really the nurse midwives were really about gaining respect and having respect for their knowledge and proud of their knowledge, whereas the midwives, not so much. It was just more about perseverance and just, you know, flogging yourself in the job. Next slide, please, Gila. And this was the religiosity motivations. So this is some of the words they used. Berufung, which is something like a calling in German. And, you know, from Christian point of life, God's agenda, that kind of thing, which again moves away from the evidence-based, science-based, that kind of angle to midwifery. Can I have the next slide, please, Gila? This is the part I was talking about, celebrating role diversity. So people saying, this is not the only job I can do. There are lots of specialities. Bearing in mind, these were mainly nurse midwives. You didn't get many midwives talking about role diversity. It was the nurse midwives who said, because I've got dual licensure, I can do this, I can do that. I can bring my midwifery hat to work. I can bring my nursing hat to work. I can do, you know, leadership positions further up at policy level, be an educator, and all these kind of business ideas. And there were far more innovative comments coming from the nurse midwives celebrating that role diversity that midwives didn't have as much because they were focused on clinical largely. Please may I have the next slide, Gila? So these were the calls for the separation of nursing and midwifery, and you can see the kind of reasons they're putting forward. So it's confusing. It's, you know, the nurse midwives are a confusing term. It should be eliminated. You can't be both. You know, you have to be one thing or another. Let's separate everything from nursing. We're our own profession. We want this in a different way. Now, this isn't always going to be achieved because in some countries you have such small populations that it's very difficult to separate the professions. But I think overall on the global scale, this is what people really wanted. And I've been thinking about this myself. You know, if I'm a hairdresser and a midwife, I'm not a hairdresser midwife, am I? So why are we kind of conflating the nurses and midwifery when, you know, one's focused on the medical model and one's on the physiological model? But that's something we can think about and talk about, I'm sure. Next slide, please, Gila. So in terms of the barriers, this was participants describing the lack of professional recognition they were getting. Midwifery work was just not seen as valued, and they just wanted more from society. You know, midwifery is not respected. They're not aware about what we do and what skills we have and what we can achieve. And those more comments like that, more data like that was coming through, and these are just a few examples. Gila, next slide, please. Oh, slide's not changing. Ooh, there we go. This was the lack of respect from other professions coming through. So this was in terms of nursing colleagues not respecting midwifery, midwives having to be led by nurses rather than being led by midwives. So nobody really understood what the midwives were about. There were second-class citizens to nurses and lots of other professions, obstetricians, gynecologists, not respecting them and coming in and deciding what's going to be done, even though it's a physiological situation. Lots of people speaking clinically here rather than in research or leadership, which is interesting again. Please may we have the next slide, Gila. So I've put this angel here because there was lots of people saying we want midwives as angels and these feminine figures, and butterflies and onions, one person said. Like I said, there was a lot of different things people said. Dawn, the opening scene from The Lion King, love, growth, connectivity, and lots of people said it was really sort of important to communicate the role of midwives on the clinical front line using real midwifery characters with personal stories. So we've got lots to work with there, but no kind of one thing about what we need. So that's interesting. Next slide, please. So they definitely said there was a strong need for a statue, a public statue of a midwife in history, a monument, visuals of midwives. Everywhere I see nurses only, can we be seen in the same way? There's a huge statue in London of the Mary Seacole. There's Florence Nightingale. There's not one midwife. So they wanted something tangible, not only digital, but they really liked the idea of art and that art's based in the public space. Next slide, please, Gila. So looking at the implications, have we got anything on that slide?
We do. Should I take it from here?
Yes, you take it from here, Gila.
So thank you so much, Sally. And this research was really incredible, and I think it was surprising for a lot of people. And when we discuss the implications, I think that there are so many implications and so many ways to interpret and take this this research. But if I were to ask everybody here, and you can write in the chat, or you can think it to yourselves, or discuss it with someone sitting next to you with a warm cup of coffee, which I assume is what everybody's doing, or tea. If I were to ask you to picture or describe the professional identity of a physician, of a doctor, or in imagery, what would that look like? You can put it in the chat, you can think about it for a second. But I think that we all would come up with something universal. And I also think that it doesn't matter where you ask this question, you'll get the same answer. It's the white coat, the stethoscope. It's this symbolism that is universal for the word physician or doctor. And the same thing for nursing. If we were to ask, what is a nurse? I think that image is global. I think it's universal. I think most of us would give similar answers. But something really fascinating happens when you discuss the word midwife. There is no image. And this is part of what Sally was discussing and part of what we found. The reason why it may be so fragmented is because it actually doesn't exist. And if you take a look at some of the imagery that happens when you start to look into this concept, you see that there's a few fascinating things. First of all, none of them look the same. Nobody here looks the same. And the other incredible aspect is that no midwife is standing alone. The midwife is always with someone, with an individual, with a woman, with a hand on a stomach, with an infant or a baby in their arms. And I think that this is a very significant yet nuanced point, that that statue that Sally was referring to, it doesn't exist, not in our minds, and certainly not in the public realm. So when I find myself confused or wondering about a question, I go to the evidence. So I say, what does the evidence say about the professional identity of a midwife? What does the evidence share about what a midwife is? And if you haven't had the opportunity to read this exceptional paper in The Lancet by Nove and other wonderful researchers, so like Homer, The Potential Impact of Midwives in Preventing and Reducing Maternal and Neonatal Mortality in Stillbirths, a live safe tool modeling study, don't leave this webinar, but as soon as it's over, read this article. Because they asked a very simple question. They said, what would happen if every person in the world had access to a midwife? And they found something fascinating. They found that across low to medium and medium to high income countries, even with a small, modest scale up, lives would be saved. They found essentially that if we had a 10% increase in access to midwives, we could save 1.3 million lives per year by 2035. Those are numbers that are incredibly hard to fathom. And even more hard to fathom is that if we had universal coverage, every woman had access to a midwife, we could save up to 4.3 million lives per year. So this tells me that part of my professional identity and my imagery is that midwives save lives. First and foremost, midwives save lives. And along with that comes, what do we provide? What care do midwives provide? What does the evidence say? Well, the evidence shows that midwives are able to provide up to 90% of essential care services across the entire health continuum. So if we bring these two aspects together, that midwives save lives and provide up to 90% of what's defined as sexual, reproductive, maternal, neonatal, and adolescent health, SRMNAH, we provide a huge amount of services and in the end result in lives saved. So the imagery that we're seeing of a hand on a stomach or a midwife holding an infant, even the imagery that we're seeing, it doesn't seem to be accurately expressing our scope. So why does this matter? Okay, so our imagery doesn't necessarily reflect our capabilities. Okay, happens. What's the big deal? What actually is a big deal? It has ramifications because this world that we live in is complicated. We were just discussing with Sue and Sally right before how complicated this world is. It is not a good place for women, for individuals, for humanity right now. In Afghanistan, women are being banned from studying midwifery. The ramifications of that small sentence are something that I literally cannot express. It will result in deaths, directly result in people dying. We know that what happened with the Yazidis and the impact of when we take minority populations and abuse them. And those people who were abused are now having babies and suffering from the fallout of that abuse. We now know that gender-based violence is being used as a weapon against civilians, women, men, children. We also know that women and other individuals don't have access to abortion care, basic health care, and they're living in vast maternity deserts with hundreds of miles needing to be traveled in order to see a healthcare professional. These are really intense statistics, really intense realities. We know that 1 in 3 women experience physical or sexual violence, generally, mostly by someone that they know, an intimate partner. And we all know that sentence, that ubiquitous sentence that every 2 minutes, a woman dies due to pregnancy or birth-related complications. And the WHO says that 80% of those deaths are preventable. How are they preventable? Well, a great solution would be if people had access to midwives. But in order to say that people need to have access to midwives, we need to have a strong professional identity. In order to market ourselves and explain the need to have women see midwives or people or individuals see midwives, we need to have a strong professional identity. We need to brand ourselves. And this is an incredibly significant aspect of our success in reaching the people who need us most. We all understand the powerful imagery of a G with primary colors. We know that that G of primary colors speaks worlds of what it actually refers to. It says its scope, its capabilities. It's not just a G with primary colors. We all understand what Google is and all of its capabilities in that one image. Imagery is powerful. A professional identity is more than just a nuance or a convenience. It literally is what markets us to the world and explains why people need midwives. And not having it has a direct implications on our ability to reach the people who need us most. So why is it like this? How did we get here? Well, Sally touched on it and the research touches on it, but midwifery is an ancient art, an ancient profession. And when you're dealing with something so ancient, sometimes we can get lost in a history. I always say that midwives are the original, we are the oldest profession. And I'm always corrected that no, prostitutes are the oldest profession. And I always respond that somebody was treating the prostitutes. Someone was delivering their babies. Someone was providing them with healthcare. It was the midwives. There have always been midwives for as long as there have been humanity. And that creates a bit of a haze because people have literally asked me, what is a midwife? Isn't that a biblical phenomenon? No, I'm not a biblical phenomenon. I may have been around forever, but I have ramifications across every era that I was in. And I think that's where the significance comes in. Maintaining our roots, as Sally was explaining, with where we've come from and all of the experience and all of our exceptional knowledge, and making it applicable in every generation that we're found. And this research found some very important things. Imagery that was given in terms of the compassion and the hand-holding is crucial. It's a crucial aspect of our profession and our professional identity. But it's time to ensure that that isn't the only way that we're defined, that midwives are seen as far more than just supportive staff. I am not here to hold your hand. I will hold your hand, and compassion is a crucial part of the holistic care that I provide. But above all, I am a primary care provider. I am here as the midwifery-led leader for midwifery-led care. And I think that imagery and finding the balance between the compassion, but not just as a side, is a very important aspect of something that came out of this research. And the second, and one of the most prominent, was the conflation. As a person who comes from a context, from a country where I have to study nursing in order to be a midwife, so I'm speaking from very personal experience, it is important that midwives stand alone. And again, finding that balance, as Sally was saying, between too strong professional identity, yet defining our professional identity and imagery. I am a midwife. And it is important that as we recognize that midwifery is a multidisciplinary profession, like all professions are, no profession works alone. No physician works without nurses. No physical therapist works without, nutritionists. We all work together. But we need to start stepping into the light as midwives and figuring out what that means. What does it mean to be a midwife? What does it look like to be a midwife? And reduce the conflation between nursing, physicians, doulas, midwives, realizing we work together, but we each have our own unique aspect that we bring to the table. And I think this is a very, very important aspect that came out from this research. So why? Why is it like this? How did we get here? And why is it so hard for us to define our professional identity? And I think it's because midwives work with the person. We work with the individual. We work with the woman. We work as person-centered care in hospitals, in birthing centers, on top of mountains, in major cities. And that means that wherever we work, we will look different. And we're providing unique care for every individual. But at the end of the day, we are all here for the same purpose. And that brings us back to the bottom line. At the end of the day, we are here to save lives. And in order to define our professional identity, I think it needs to include some main aspects that might cut through the noise and the clarity. Number one, we are an independent profession. Even, I think Sally said it perfectly. If I'm a hairdresser, many people do many things. If I was a hairdresser, I can be a hairdresser and a midwife. Neither takes away from the other. But as a midwife, I'm an independent profession. And that independent profession stands alone without any oversight from any other profession. At the same time, I'm autonomous. That means that I get to govern this profession and determine my own scope. Independence and autonomy are not the same thing. They are inherently linked, but they are not the same thing. We also have a full scope of practice that we work to 90% of the care that we can provide for women and their families and individuals. And we are crucial healthcare professionals. Without us, people die. Access to midwives saves lives. I think these 4 things are key when we're going to start discussing our professional identity. So at the end of the day, despite the fact that we look different wherever we practice, despite the fact that midwives serve all aspects of the community and all types of people, I think the core here is the imagery and the professional identity need to go back to the basics. People need access to midwives. Midwives save lives. And if we can somehow create that sense of imagery and that sense of branding and step into the 21st century and step into the light and say, we are midwives. We are here. Find us. Let us have access to all the people who need us. I think then we will be more successful. Back to you, Sally.
Thank you, Gina. So I just wanted to end with our project with Professor Mary Fussell and Johns Hopkins University, where we are finding that midwife and our own sense of midwifery as we connect with midwifery's past and link it to what we're going through today and where we need to go in the future. And perhaps it is a whole rebranding, perhaps it is a whole different direction because what we're doing isn't necessarily working. We don't have a strong professional identity and we don't save lives as to the extent that we could yet. So perhaps that one needs looking at. And this research, we're pulling together a documentary of us finding the midwife, and hopefully that documentary will be ready soon for people to have a look at, pilot, and hopefully follow us along in the journey. You can definitely sign up to our newsletter on the findthemidwife.com and follow us on our journey as midwives join with historians and filmmakers to work out who is our Florence Nightingale, basically. We launched in April last year and we're still going with this project. And I just wanted to leave that with everybody to hopefully explore. And we don't know where we're going on this journey, but we're all on it together. So join us as we go, I think is the message. And I think the last slide is questions.
Thank you so much, Sally and Gila. That's very exciting and it's very challenging. And in my mind, I'm thinking, how would you get the logo? I think it was the logo sheet that sort of threw me a little bit, because I'm thinking, how could we have a logo that sums it all up? Or, and I know from my work with the textbook, images are really important, and getting the right image that sums up. I had a real feeling of it. I needed this about 3 years ago to be able to search out these images, because it was a challenge, because there were so many nursing focused images that they didn't sum up what you wanted to really celebrate. So thank you so much for sharing that with us. We do have a question. And that's from Sheila Brown, or a comment actually. This is Sheila. Hi, Sheila. And Sheila says, so interestingly, the lack of respect from other professions. Definitely noted in the UK, in my experience, with resonance in education. Okay, and then she goes on to say, why is it that they're not more respected? Is it because midwives are predominantly women serving women? Answers, please, on a very large postcard. Sally, what do you think?
We did explore gender in the discussion of this because, yes, gender certainly has a lot to do with it. And I've written papers other than this on the need for gender equity and reproductive justice and the problematic link that we have with gender in that it's seen as very binary rather than fluid, and the patriarchy oppresses us all. And how does midwifery fit into that as probably one of the most gendered professions there is? How are we affected by the patriarchy most? And I won't go into that here, but there's lots you can read my papers on those other things. And we did talk about that here because is it feminized work? You know, because it's considered a feminized act, then the act of midwifing is also feminized, and that's not valued by our society. And the medical model as well. You know, the medical model fixes things. It's about fixing, and the nurses are aligned with the medical model, whereas we're not. And we're not necessarily about fixing things because we're about promoting what's already happening physiologically. So that kind of dichotomy is also around in terms of what do we value? Do we value fixing things, or do we value supporting physiological processes? That's not as exciting and sexy as this. And if that's true, why? Because again, has it been feminized and masculinized? We're thinking big on those topics, and again, it can be quite controversial to think about big rebrands, but you know, with the evidence in front of us, big change is needed, I think.
And Gila, I mean, I think when you're sort of talking about the sort of one woman dying every two minutes and the sort of context of different countries, and of course you had midwives and nurse midwives from different countries. I mean, in a way, Sheila's talking about the UK, I think. And actually, I don't think we're probably have as many problems as some of the other countries where women are under such difficult circumstances because the women aren't valued in the same way. I kind of like to think we do have some value, but not perhaps as much as we like. But Julia, would you like to comment on that?
Excellent question. And it's a question that has been asked for centuries. I just finished a review of reviews where I analyzed the barriers of facilitators to implementing continuity of midwife care. And one of the fascinating things that we found, which is exactly what you just said, Sue, it's that you said, well, this is relevant to the UK. One of the incredible things that we found in this review is that the barriers and these issues like respect and gender issues, they are everywhere. They're global. They were stated in the United States. They were stated in Iran. They were stated in India. They were all the same. And I think that that is a really crucial question. This doesn't have any impact. They were across all contexts, birthing centers, home, hospitals, across all aspects of care in every region of the WHO across the globe. And I think that that's a really important question. And the answer is entrenched in our history. There were countries that had active campaigns. The United States had an active campaign against the midwife, the dirty midwife. For those of you who are familiar, there are a lot of books on this. You can read about it. There's research. They were actively campaigned against. They were shown as witches and as dirty and as dangerous as birth moved from home to hospital. The answer is so entrenched in our history. And I think that this is exactly what we're discussing now. How do we include our history and involve our history for these issues like lack of respect and gender identity and scope of practice, and move from the past towards the future? And a lot of it is going to rely on our professional identity, being able to explain that we are far more than what people think we are.
And not just witches.
No.
At all, not witches at all. No, I mean, I was interested in the kind of public life, because what popped into my brain, I can't remember that many programs on TV with a midwife in them, like acting or whatever. I can remember one, which was William and Mary. Do you remember that? It was Mary was a midwife and William was an undertaker of all things, and it was their sort of romance. But if I think to the kind of the same in, say, medics, there's plenty to look at. Medics, I know Doctor in the House. I mean, it's an old one, but it's been around. And nurses have had a lot of documentaries and kind of sightings in soap operas. So do we need to have more midwives in soap operas? That's the next question. It's just occurred to me, a soap opera midwife.
I think if they were represented properly, that's the danger, isn't it? Because there's stereotypes about midwives as well. And, they're only a midwife if they're practicing clinically on labour ward or, in the Highlands, or home birth midwife, called the midwife. If you've got a midwife doing research and teaching, they're not a real midwife, So it would really depend if we had that representation. It needs to be accurate representation and not kind of fanciful and stereotyped. And I think we need to rebrand ourselves so that we're not stereotyped.
Well,
What's fascinating about that is that physicians have the same concept of scope. They practice across research and education and clinic, and they don't have this issue. Meaning, when people say it's impossible because the image of a midwife is so broad and so complex, we are not the only profession with a broad, complex scope of practice. Other professions have this as well, and they're successful in integrating that imagery into all aspects of their care. It's not impossible. We just need to be able to do it.
No, that's a very good comparison, actually. Thank you for that. That's good. Okay. And I've got Helena Aimi. I hope I pronounced that correctly, Helena. Don't you both think that if we just focus on maternity and not in reproductive women's health, this is detrimental for our professional competencies and identity? I mean, other midwives abroad are also responsible for menopause, STDs, etc., etc.
Gila's usually the one talking about scope of practice. She normally has very strong views about this, so I'm going to turn this to Gila.
I do have very strong views about this. I think that we're lucky enough that we don't need to answer that question. That answer is defined for us by overwhelming global governing bodies that have clearly defined that our scope of practice is far beyond birth, prenatal, and postnatal care. Midwives are women's health professionals, experts. Losing aspects of that scope of practice would, I believe, be detrimental to our professional identity.
I was going to say a lot of that, I think, is within the proficiencies, the NMC, the UK, plus the International Confederation competencies, which do include quite a lot around women's health.
But also a lot of the evidence as regards to continuity of midwife care, what's known as it's also known as midwifery continuity of care, midwifery-led continuity of care. There's so many terminology with which the WHO is now trying to standardize, but the evidence lies in the continuity. The evidence lies in our ability to treat a woman or an individual from start to finish throughout their entire healthcare continuum. That's where the real success is. And if we isolate an individual to this specific aspect of their life, which is labor, birth, and the postpartum period, we're missing out on so much more that we could provide.
That's a great answer. Thank you, Sheila. Okay, I haven't got another question. Well, I think everyone's having chats together. Now, remember, you've only got a minute or two to get any more questions in before that. And I mean, I was interested also, because I've jotted down my little notes. Midwives do have a protected title, certainly in the UK. And that should actually, you would think that would protect them and give them that professional identity, full stop. No, Sally?
I don't think it does. And, last month now, I wrote a paper about the professional title of midwifery.
You did?
Yes. And it not being wholly accurate in what we do. We are not only with women, we are with everyone who births, and not all people who birth are women. And I don't think it, and I don't think it really screams, you know, anything wider than being clinically focused again, because it brings up those images of just being, you know, in that clinical birth room and nowhere else. And of course, midwives have to be in lots of places and high authority to do the thing that Gila was saying, save lives. We don't just save lives in the birth room, we save it through policy, through writing clinical guidelines, through research, through education. So yes, we're doing everything Gila says, but we do not only do that in the birth room, and we don't only do that with women. So I know it was a controversial paper, but I urge people to read it and think and try and be a bit uncomfortable with it, even if it's just, you know, questioning and asking the uncomfortable questions.
Yeah, absolutely. I mean, it was an interesting. I think we didn't have that on the resources sheet, but we'll put it on the forum later, so you can have a look, because it's an interesting piece, Sally. Definitely.
Yes.
Things to think about in a different way, which is great. Now, I've got a comment again from Sheila saying evidence is what supports students to become professionals, indicates continuity experiences are key experiences, which is actually what Gila said beautifully as well. So that's fantastic. And I mean, I think the other thing that I was interested in the religiosity, actually, because I think that used to be something that nurses used to talk a lot about, didn't they?
Yeah.
And I kind of hadn't, that was quite a surprise to me when you talked about that.
Yeah, I mean, it came through from certain countries, which, you know, you could probably link back to. We didn't have enough numbers to link back, you know, categorically, but you did observe it was from certain countries. And also, yeah, I think it was the American nurses pledge. It's the Florence Nightingale pledge that nurses had to pledge to, and that was allegiance to God, and also allegiance to purity. There's lots of things about purity in there, which are obviously very highly gendered and patriarchal, problematic things to do. And so there is danger with over genderizing, over, you know, making things over feminized and over religion, you know, linking things with religion. And there's a really interesting paper that we cite in the discussion that kind of links that religiosity with problematic thinking in terms of that evidence-based practice and development of a professional identity, which is why we recommended the move away from religiosity if we're wanting to be respected as evidence-based practitioners doing research and evidence-based practice. Although the art of midwifery is certainly there, it's not linked to that religiosity. But of course, everyone comes to the profession from their own stance, and that will always be.
And the art, I suppose, is using the evidence creatively sometimes. Thank you for that. Okay, that's fabulous. Now, I always say this hour goes so quickly, and my brain is just slightly full. And I think to the audience, do share this with your friends and colleagues, because I think this is a really interesting area for us as midwives to be aware of, because identity is crucial, and the sort of aspect. And I know when I read it, I was surprised that it was the nurse midwives that had a stronger professional identity than midwives, because I would always thought it was the other way around. I know my own identity, and of course I started off as a nurse because that's what the majority of people did when I came into midwifery. But I kind of thought things might have adjusted a little bit there. But interesting. Do have a read of it. It's really, really excellent article to read, and it's on your list. And I'm going to say, I've got a comment or two. Oh, hi, Nicolette Porter. Hi, Nicolette. Nicolette says, great presentation, Sally and Gila. So interesting. And Sheila Brown also says, great presentation, inspiring for future midwives. And I think it is, because one, we need to know where we've been before we know where we're going. But also, we do need to know about what we are, which is very, I'm finding it difficult to express. So goodness knows how you guys did with the whole research issue. But if it's linked up, and it will improve people's own self-respect as well as respect to the profession, it will help recruitment and retention. And at the moment, that's the big thing for us as midwives. And we need to not just feel better about ourselves, but really value each other, value ourselves, and have value wider out there, because we are. Because midwives do save lives. And it's the one key. Now, Mary Renfrew always says it's about a bit about midwifery care, and continuity of care is one of the biggest midwifery interventions which saves and values better life. So fantastic. Thank you so much to Gila and Sally. So I'm going to come to the end, and I'm going to say thank you again to Sally and Gila for joining us. Also, Angelo, who's been making sure this is all beautifully recorded. Paul, who's been feeding the comments through to me to make sure everything's running smoothly. Resources should be available still, and you'll have those people who want that podcast 6 o'clock in the morning on Friday. It'll be there. This will also come out in the newsletter on Tuesday. If you're not signed in for the newsletter, it's worth signing into the Maternity and Midwifery Forum newsletter, because you get great articles plus these links into the Maternity Midwifery Hour, which is really useful. And do share and get discussing. Next week, it's funny, the word was used, Sally used it a bit earlier, we're looking at doulas, midwifery and maternity services, another really interesting area for us that we need to know plenty about. So see you next week, same place, same time, 7 till 8. Stay safe and well, and look after yourselves. Don't forget to book for the Midlands Festival. It's in Nottingham this year. So if you fancy a trip to Nottingham, that's where we'll be on the 20th of May. Got some superb speakers. And otherwise, we'll see you next week. So thank you for coming to this evening. Thank you for the questions and the comments. Take care. See you next week.